United Taper Fit Stem, Reduced Type. UTF Reduced Stem is a taper stem. The taper stem is not a new design concept. It can trace back to the Zwiefmuller stem, which was designed by Dr. Carl Zwiefmuller in 1979. In that time, the modern technology of the surface treatment has not been developed. Therefore, the rough surface of the first taper stem is made with sandblasting. The blasted stem increases the friction between the bone and the stem interface, and achieves well-press fitted and stem stability. The concept of the taper stem was accepted by most orthopedic surgeons since 1980s. The major design feature is the longitudinal tapers in the AP and lateral dimension. This doubled taper provides axial stability. Besides, the rectangular cross-section provides the rotational stability by well corners engaging. Furthermore, the broaching-only surgical technique not only reduces operating time, but preserves more host bone. This is beneficial to revision surgery, particularly for younger patients. To this day, the usage of the taper stem is over 30 years. The original Zwiefmuller stem and other taper stems have been proven that the 10 to 20 years survivorship is more than 95%. It demonstrated that the taper stem is a reliable product for long-term usage. Even though the early taper stem has good long-term survivorship, the stress shielding effect in proximal femur is reported. The stress shielding effect could induce osteolysis and bone resorption. In this paper, the author observed bone resorption in proximal femur after implanting DePuy Trilok stem over 10 years. We believe that the possible cause of the proximal bone resorption is induced by distal fixation. Distal fixation is associated with larger distal dimension and insufficient size distribution, particular for the patients with champagne-shaped canal. Therefore, UTF Reduced Stem is designed with refined proximal sizes and reduced distal ML width to achieve optimal proximal fit and avoid stress shielding. For the purposes of joint stability and easy implantation, UTF Reduced Stem has standard and high offset options and curved lateral tip design. The proximal width and size interval of the UTF Reduced Stem are shown in this table. The increment between size 3 to size 8 is 1 millimeter. For size 9 and size 10, the increments are designed with 1.5 millimeters. From size 11 to 14, the increments are 2 millimeters. The refined and regular size change enhances the predictability during the preparation of the stem. The surgeons can predict the feeling of broaching easily and determine the final size accurately. The cross-section of the UTF Reduced Stem inherits the classical spirit of the taper design. The 4 rectangular corners engage to cortical bone and provide the rotational stability firmly. Hence, the operator feels the solid impacting feedback during stem broaching and implantation. To avoid distal femoral engagement and the risk of stress shielding, the UTF stem reduces the distal ML width. This is advantageous to prevent intraoperative bone fracture and reduce the happening of stress shielding in all types of canal shape. The next feature is about the joint stability. UTF Reduced Stem system has standard and high offset options to restore normal ligamentous laxity. Compared with the standard offset, the high offset stems shift the stem neck horizontally to gain longer offset length. The change of the offset length has no influences on leg length, so the operator can focus on the single parameter, the offset. There are 14 sizes of the UTF Reduced Stems. The offset differences between the standard and high offset stems are 6, 7, or 8 millimeters, depending on the stem size. The final major design feature of the UTF Reduced Stem is the lateral curved tip. The curved tip avoids the distal stress concentration and reduces the risk of thigh pain. Also, the broaches of the UTF Reduced Stem are designed with smooth lateral tip to direct stem alignment correctly without creating a new pathway. This could reduce the risk of shaft fracture while broaching. Compared with the commercial products provided by Stryker, Zimmer, Biomet, and Smith & Nephew, only DePuy Trilock and Stryker Accolade II have the same lateral curved tip design. The new surgical tools are also introduced into the UTF Reduced Stem system. During implantation, the operators use the Quick Connect handle to hold the implant securely and advance the stem into the proper place. The Quick Connect handle serves as an initial stem impactor. Besides, the new design of the neck trials and the head trials adopts the C-ring locking mechanism. The C-ring eases the assembling and disassembling steps during operation. The UTF Reduced Stem system also provides standard, offset, and dual offset broach handle to meet different surgical approaches, particular for MIS surgery and direct anterior approach. The handy instrument of the UTF Reduced Stem fulfills the surgeon's needs and then saves the operation time. Here are two examples of the UTF Reduced Stem. This post-operative X-ray is provided by the surgeon in Taiwan. UTF Reduced Stem is also available on the international market. This case is provided by a U.S. surgeon. A UTF Reduced Stem and U-Motion 2 acetabular system were selected for the patient. The patient and the surgeon are satisfied with the clinical outcome. These are the design rationale of the UTF Reduced Stem. Thank you for listening.